Hello, Rhode Island deaf and hard of hearing community, and welcome. This vlog today will be giving you some information that's just been released from the Department of Health. This is an update on vaccines for COVID-19. This is a brand new update, something you've never heard before. The CDC and the Department of Health is encouraging you to get this vaccine, especially to prepare for this fall and winter 23 and 24. The Rhode Island Department of Health, along with the CDC and the FDA, have been investigating and made this determination that this vaccine for this winter is very appropriate. You might remember that 3 years ago, the numbers were very high. They were spiking and a lot of people were getting sick. And even last January, 2022, the numbers spiked again. We don't want to see this spike happen this winter, so we're encouraging you to get the vaccine. It's called a monovalent vaccine, and that means it targets one variant, which is the Omicron variant, XBB.1.5. The vaccine is for everyone, beginning at age 6 months, all the way up to senior citizens to age 100. Everyone is eligible for this vaccine. Even if you've never had a vaccine before or you've been a little bit reluctant to get one, you're encouraged to go ahead and get this vaccine. It doesn't matter about the past. If you get this vaccine, you'll be covered. This vaccine is issued at no cost, just like previous vaccines. If you take this, you do not have to pay for it. It's covered by your health insurance, it's covered by Medicaid, it's covered by Medicare, or for those of you who have no insurance, the federal government will cover the cost of the vaccine. There are certain places, federal health centers, where you can go and get this vaccine. So keep that in mind, that you do not have to pay for this new vaccine. I have some important points that I'd like you to keep in mind why you should get this particular vaccine. First of all, research has shown, after 4 years of data, this vaccine, it's the best tool for protecting COVID from spreading. It's been proven, and the numbers have gone way down, and people have recovered from the COVID that they did get. The vaccine will prevent you from getting long-term COVID. Long COVID. I'm sure you know people who've been sick from COVID, and they're still sick, sometimes for a few months and sometimes for a couple of years. This vaccine will prevent that. Also, when should you get this vaccine? If you've had a vaccine within the last 2 months, you should wait. Once you get that, past that 2-month period, you can go ahead and have the vaccine. Talk to your healthcare professional to double check on this. Typically, if you haven't had a vaccine in the last 2 months, you'll be eligible. Remember, COVID-19, that virus keeps changing. It's evolving, and new mutations arise on a regular basis. Scientists are still tracking it and looking for a cure, but there isn't any 100% cure at this point. Fortunately, the numbers are low. People aren't wearing masks as much. It's still very important that you keep up to date with your vaccines, so you have a better chance of not getting sick in the first place, protecting your family and your friends. We don't want to go through what happened 2 and 3 years ago. Here in the United States, there are 3 vaccines being offered: Pfizer, BioNTech, Moderna, and Novavax. Those are the three offers. You may see different names. It doesn't matter. Make sure that you get one of those. Whether or not you have insurance, you're still eligible for the vaccine. If you have health insurance, your health insurance will cover the cost. If you don't have health insurance, contact your physician or go to your community health center and ask where you can get the vaccine, and they'll tell you the nearest place. They may have it there, or your local pharmacy may have it. But remember, you don't have to pay for it. All vaccines for the COVID virus are free. There are 4 recommendations regarding the vaccine. Everyone age 5 and up should go ahead and get 1 dose of this new vaccine. Secondly, if you're immunocompromised, you can get a 2nd or 3rd dose after you've gotten that 1st dose. Check this with your doctor. Let them know that you've had one and whether or not you should get future doses. Thirdly, for infants from age 6 months up to 5 years, if they've been vaccinated, they can get this new vaccine. But check with your family pediatrician to make sure before you vaccinate your children. And lastly, if you have an infant 6 months to 5 years old who has never been vaccinated, we recommend that you talk to your doctor first to make sure that it's okay or not. There are different formulas for children versus adults. If you are over 5 years old, however, you are eligible for this new vaccine. So those are the 4 recommendations. I'd like to talk about the flu shot, the RSV shot, and the COVID vaccine. A lot of people wonder if they in any way conflict with one another. In fact, you can get the flu shot and the COVID vaccine at the same time. The flu shot can minimize the symptoms of colds, coughs, common cold symptoms. They can be minimized by the flu shot. And there's another category of shots for more severe things like mumps, German measles, polio, tuberculosis. Those are regular vaccines that we get throughout our lives. COVID-19, that vaccine falls somewhere in the middle because there is no definite cure. So it's a standalone shot away from the flu shot and certainly away from the more severe illnesses like polio and tetanus. So we're also going to address the RSV shot. What I recommend is that you discuss with your doctor and what your doctor recommends for you in terms of vaccines. If you're COVID positive, or you've been positive within the last 3 months, you might want to consider delaying your vaccine. Wait 3 months after you've recovered from COVID before you take the updated vaccine. If you're not sure, check with your healthcare practitioner. The doctor can explain to you when would be the correct time to get your latest vaccine. Where can you get the COVID vaccine? There are a few places. your local pharmacy, CVS, Walgreens, etc., your primary care physician. Some doctors' offices offer the vaccine, others don't. Your local community health center. Just like before, we encourage you to look on the website to see where you can get the vaccine. And there should be a number of locations. Some require an appointment, others are walk-in. So check the website for more information. How can you prevent COVID-19 from spreading? The message from the CDC and the Department of Health in Rhode Island remains the same. If you don't feel well, stay home. Don't go to work. Don't go out with your friends. Don't attend a large family gathering. Stay out of school. Remember, if you take your temperature and it's above 100 Fahrenheit, stay home. When it's below 100 degrees for 24 hours, then you're free to go out again. Secondly, if you do have a positive COVID test, you need to isolate. Stay in your room at home. If you're traveling, stay in one place. Don't circulate with other people. Don't hang out with friends and families, especially senior citizens or people who could be immunocompromised. If they catch COVID, it could be very serious. Be sure to wash your hands with soap and water for at least 20 seconds. And do that all day long. Make that a habit. If you sneeze or cough, be sure to cover your mouth with your hand or with your elbow to prevent others from catching COVID. If you feel a little strangeness in your chest, you're cold, you have a fever, call your family doctor. See where you can get tested. They may have you come into their office for a test, or they may recommend a local pharmacy. Or if you have a test at home, make sure that you check the expiration date. If it has expired, don't use it. If it's still good, go ahead and give yourself the test. But we recommend that you check with your doctor, because if you are positive, they can tell you what to do. So keep that in mind.